share my screen. All right, can you see it?
Yes.
Okay, so here are the evidence maps, and we chose autism as our topic. And within autism, the practice area we chose, was assessment. And the domain we chose was speech and language. And we made the publication date range 2019, and we came up with these 4 articles. Okay, these 4 articles, and Helen's gonna start.
Yes.
Your summary.
Okay, so the first article I will go over is Standards of Diagnostic Assessment for Autism Spectrum Disorder. So this article provides recommendations on the diagnostic procedures for autism spectrum disorder. Since there is a rising prevalence of autism, there is a need to expand the capability of primary care doctors to recognize and diagnose autism, because a lot of children are diagnosed at a later age. And although there is evidence to suggest that they can be definitively diagnosed by age 2, many are diagnosed at age 4 and 5. So while it is still recommended that a multidisciplinary team get involved in the diagnosis process, it usually takes a year before children are even referred out. And this prolongs how soon children can begin receiving specialized services. So the article highlights 8 elements that must be included in a autism diagnostic assessment. Step 1 would be reviewing medical records, and this includes birth records, routine visits, any assessments, autism screening, etc. Step 2 would be interviewing the parents or family members or any other caregivers. So clinicians would basically ask them open-ended questions. Step 3 would be an assessment for the core features of autism. And it's here that in a ASD specific diagnostic tool can be used. Step 4 would be comprehensive physical examination and any additional investigation. And this can involve anything from just height and weight, or indicating the need for an EGG, MRI. Step 5 would be to consider differential diagnoses and co-occurring conditions. And this involves considering any diagnoses that may be mimicking autism or any disorders that might overlap. Step 6 is establishing an autism diagnoses using the DSM-5 criteria and clinical judgment, of course. Step 7 is communicating the ASD diagnostic assessment finding to the parent and child when age and otherwise appropriate. Step 8 is to consider a comprehensive assessment for intervention planning if this was not part of the initial diagnostic evaluation. So that was the first article. And for the second article, it's named Use of the Lena Autism Screen with Children Who Are Deaf or Hard of Hearing. And this article reports the evidence from literature concerning the use of the language environment analysis, also known as LENA, to screen children that are at risk for autism and deaf or hard of hearing. The article states that both ASD and D/HH have increased comorbidity, but behavioral diagnostic and screening tools have limitations, and thus the LENA, which is an automated local analysis, can be a tool to disambiguate ASD from deaf or hard of hearing. Children who have been late identified hearing loss may exhibit certain behaviors such as non-speech vocalizations like shrieks, cries, or screams, which have been described as autistic-like. So differential diagnoses is needed in order to begin treatment, and a screening tool such as Lena may aid in differential diagnoses. Although studies were limited because of the small sample size, there is evidence that automatic vocal analysis methods are able to play a role in screening for communicative disorders.
Okay. So the first article I chose was the meta-analysis of the predictability of the LANA automated measures for child language development. And LANA stands for, as Helen said, the language environment analysis. And so this article studies a group of 2-year-olds and younger, both with or without disabilities, and it tests the ability of the language environment analysis to help predict and better determine the language development among the young population. So the way this is conducted and done is by collecting day-long recordings of the child's learning environment. So that might be in a preschool, at a home, at a daycare. So they just collect day-long recordings, and then they measure the amount of exposure to language throughout the day, and it allows them to predict for the language skills in young children. So that's pretty interesting. And the researchers look for associations between the measures from the language environment analysis and adult word count, conversational turn count, and child vocalization count, and the language skills in children younger, and just overall language skills in children younger than 2 years old. So they see kind of how much of exposure to language and type of language that children 2 years and younger are getting throughout a day. So the findings were that overall there was a medium effect size for the correlation between this LANA analysis, the language environment analysis, and language skills. So there are also findings that the measures from the language environment analysis might have less predictive ability on long-term outcomes. So it's more of a short-term, the they're able to find the correlation. It's better like the short-term outcomes rather than long-term outcomes. And I think that this type of analysis, it's super interesting, and it can be very useful in many fields. However, it definitely needs, I think, more work and research on it to strengthen the relationship between seeing the exposure of a young child's language, adult language exposure throughout a day, and when a child will get their language. So the next article I read was called Identification, Evaluation, and Management of Children with Autism Spectrum Disorder. And this was a guideline, and the autism spectrum disorder, it's a neurodevelopmental disorder that is reported to be seen in 1 in 59 children in the United States. And children with ASD struggle with social interaction as well as communication and repetitive behavior difficulties, as well as many other difficulties in their daily life. So screening for autism spectrum disorder is recommended to families as early as 18 and 24 months of age, which seems super early, seems super young, but children can be diagnosed as young as 18 months due to how common it is. How common ASD is. And when a young child is diagnosed with autism early on, there are many evidence-based interventions for the child and for the family to help improve function. So the trajectory of development for a child who may have autism spectrum or ASD, autism spectrum disorder, may be hard to determine at the time at which the child's diagnosed. However, studies show that most children who have been diagnosed with autism after a comprehensive evaluation at less than 3 years have retained their diagnosis. This article highly recommends that early identification and treatment is most beneficial to the child as well as to the family when providers use proper screening and surveillance, which can provide for accurate identification. And it also says that when it's also most cost effective and conducted in a timely manner, it's most beneficial. So those were our articles that we found. And I think we both read an article on the Lena, the language, um, the language environment analysis. I thought that was super interesting to read about. I think I would like to see more research on that. But yeah.
Definitely. I've never heard of it until now.
Mm-hmm. Okay. I'm going to stop this. All right. To stop.
So,
Oh, wait. It's recording.
yeah.